Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, today onwards we shall start a new series of lectures and this is related to role of Pancha in childhood neurological disorders. The hot topic of the present day scenario. There are a lot of neurological problems and at the end they will come to the Ayurveda pediatrician and how we can administer panchakarmas or apply panchakarma treatment in these children to offer maximum benefit. So this series of talks is related to role of panchakarma in childhood neurological disorders. In the beginning we shall start with the basics and then we will move on to the different panchakarma procedures. Now neurological disorders. When we talk about neurological disorders in children, first we have to do the anatomical classifications. Now we cannot treat all the neurological disorders as one and we cannot employ or administer a similar type of panchakarma therapies or similar type of treatment principle for all neurological problems. It is not like that. If you are doing like that, you cannot get the expected result. Therefore I am telling, in neurological disorders, when the patient is coming to you, first you decide whether this neurological disorder is related to the white matter of the brain and spinal cord, whether it is related to the grey matter of the brain, whether it is related to autonomic nervous system, and whether it is related to a purely peripheral nerve disorder. This anatomical classification is very important. White matter disorder means it is related to the nerves. All the nerves, tracts, ascending tract, descending tract, sensory tracts, motor tracts, which is coming to the brain and going out of the brain, so they are included under the heading of white matter. Okay, so main purpose of this white matter or the nerves or bundles of nerves is only to carry the impulse. They are not related with the higher mental functions. So in pure white matter disorder, what actually happens, only the motor activity or sensor activity that is get disturbed or decreased. But there is no problem related to the higher mental function, because higher mental functions like memory, gait, speech, abstract thinking, then cognition and all those things, so this will be managed by grey matter of the brain. So first you decide it is a white matter disorder or grey matter disorder. There are set of white matter disorders, dystrophies, leukodystrophies, they comes under the category of white matter disorders. Okay, leuko means also white. Okay, leukodystrophy, leukoadenodystrophy is there. Now grey matter disorders, as I told, this is greatly related to the higher mental functions. The memory is a higher mental function. Speech is a higher mental function. Abstract thinking, then planning, okay, then internalization or realization, cognition, understanding, okay, logical thinking. So these are all the functions of higher mental functions, and all the higher mental functions are basically grey matter disorders. Okay, otherwise the grey matter disorder means it is something which is related to the neuronal nucleus. Okay, if you take a neuron, axon and dendrites of the neurons, they form the white matter. Whereas the core portion, cell portion which contains nucleus, so that is called as a grey matter. That is called as grey matter. The cortex is formed by the nucleus of the neurons. Okay, whereas tracts, perimeter tract, extrapyramidal tract, so they are all formed by the white matter. That means the axon and dendrites of the neuron. Okay, now when I say sensory cortex, motor cortex is nothing but accumulation of the neuronal cells in a place. From there the axons come down and come up. Okay, so grey matter means it is a nucleus of the neuron. So therefore those disorders in which there is a seizures or epileptiform discharges, that means seizure where abnormal electrical discharge is seen, that is also not from the axons or dendrites. It is basically from the nucleus. So all the seizure disorders where there is abnormal electrical activity is there, that is also included under gray matter. That is also included under gray matter. So treatment of the white matter disorders and treatment of the gray matter disorders differs in the contemporary science and also in Ayurveda. So this classification we should know, otherwise we will miss the track. Third one is autonomic nervous system disorder. Autonomic nervous system includes two things, sympathetic and parasympathetic. Now sympathetic and parasympathetic both are also called as visceral motor fibers. That means sympathetic and parasympathetic system never carries the function of sensation. They are purely motor. They are motor visceral. Visceral means organs. So there are the motor fibers which actually supplies to the different organs, glands, etc. Okay, so they are called as autonomic because they are autonomous. Okay, they start from the hypothalamus, different areas of the hypothalamus, medial nucleus, lateral nucleus, like that, and then they spread all over the body, and their branches supplies to each and every organ of the body, gland of the body. Okay, so therefore, if the problem is there with related to autonomic nervous system, then the approach is different. Now suppose a patient is having incontinence of the urine. Okay, there is no bladder control. Most probably this is what you say autonomic nervous system problem. Excess sweating is there. Okay, so that is autonomic nervous system problem, sympathetic or parasympathetic. So this classification should be also clear. Whether lastly, peripheral nerve disorders, whether the disorder is purely peripheral lower motor neuron disease, suppose. Okay, there is injury to the radial nerve, injury to the ulnar nerve, injury to the brachial plexus. Okay, so these are all the peripheral nerve disorders. Peripheral nerve disorders may be, for example, Guillain-Barré syndrome. Guillain-Barré syndrome. It is an autoimmune disorder related to the peripheral nerves. Therefore, it is also called as polyneuritis. Okay, so it's a peripheral nerve disorders. Maybe brachial palsy, peripheral nerve disorder. So now, before starting the Ayurvedic treatment, this point has to be made very, very clear that whether this is a white matter disorder, grey matter disorder, autonomic nerve system disorder, peripheral nerve disorder, or most of the time it may be a combination of all. It may be a combination of all. So next, neurological disorders, anatomical classification. One more set of anatomical classification is whether the disorder, disease that you are dealing, whether it is an upper motor neuron disorder, whether this is a lower motor neuron disorder, whether this is sympathetic or parasympathetic disorder, whether this is a disease of the neuromuscular junction, whether this is a pure motor or pure sensory disorder. This classification is also important because all these things will going to help, because upper motor neuron disorders, the set of symptoms will be different. You will have exaggerated reflexes, you will have group of the muscles affected, you will have tone is increased, hypertonicity or spasticity will be there. Whereas lower motor neuron disorder, you will have atrophy, okay, you will have flaccidity and reflex are lost completely. So we should understand that because upper motor neurons will have an inhibitory effect on the lower motor. All the upper motor fibers, they will have an inhibitory effects over the lower motors. Okay, so a pure upper motor disorders will, if it get affected, if there is an upper motor neuron problem is there, then that inhibitory effect over the lower motor neuron will be get lost, and now lower motor neuron will start functioning autonomously. Okay, the tone decrease, like that, many things will be there. So that's the reason why in upper motor neuron lesion tone is increased. The reason is the inhibitory effect which is coming from the upper motor neuron over the lower motor neuron is get lost. Now your lower motor neuron is acting autonomously and nobody is there to control it, so tone etc. will be increased. Then we will say in upper motor neuron lesion tone is increased. This is one example I am giving. So understanding of this point is very important when you apply the treatment. Similarly, neuromuscular junction disorder and also pure motor and sensory disorder. This classification should be very clear. One more important thing before starting the treatment that you should know is whatever the neurological disorders that you are dealing, what is the pathology behind it? Why it happened? What is the pathology? Whether that has happened because of some degeneration, whether that is happened because of demyelination, the myelin sheath of the nerve is get affected, whether it has happened because of desquamation, or whether it is an atrophic disease, whether it is a metabolic disease affecting the neurons, Whether it is a storage disorder, unwanted substances are coming and get stored over the nerves, and that leads to compression, and then the compression effect starts. Whether this is such a problem, whether this is an autoimmune problem, some autoimmunity happen. For example, myasthenia gravis, maybe multiple sclerosis, Guillain-Barré syndrome. There are autoimmune disorders. Then whether it's a congenital, many times the neurological problems are because of congenital problem. Arnold's cherry malformation, Dandy-Walker, then hydrocephalus, communicating, non-communicating type, and some of the malformation, congenital malformation related to the brain, corpus callosum is absent, like that. So then the approach will going to differ, isn't it? Your approach will going to differ. Or whether it is space occupying lesion, whether it is simply in a space occupying lesion, there is some tumor is growing up. So without knowing this, you cannot start the treatment. Okay? Because if you do so, there is no clarity of treatment. So knowing the cause is very important. Similarly, this is second set of things that you have to understand. Third one is etiology also you have to understand. Etiology wise also you have to understand whether this particular neurological disease which is coming to me, so the origin, etiology of this disease is whether vascular, some vessels ruptured and there is some clotting, thrombosis, embolism, etc., whether that is a cause. Vascular phenomena. Most of the time vascular phenomena are very, very sudden onset, just like in paralysis, adult type of paralysis, sudden origin. Then metabolic, sometimes the metabolic problem may be leading to the neurological disorders, acidemia, maybe acidosis, alkalosis, then ammonia metabolism is get affected. Then sometimes deficiency, metabolic disorders may be because of the deficiency. Okay, vitamin B12 deficiency is very commonly leads to neurological problem. Vitamin A deficiency leads to neurological problem, or fat metabolism, fat deficiency. Some other micronutrient deficiency like calcium, magnesium, etc. So this is very important before starting the treatment. Developmental, whether this problem is a developmental problem, whether this problem is because of trauma, whether this problem is because of toxicity of the drugs or poisons, etc. Whether the disease is autoimmune or whether the disease is environmental. So etiological, pathological and anatomical diagnosis of the patient is very, very important before starting Ayurveda treatment, maybe other treatment or Panchakarma treatment. Okay, so this is the first step in approach to neurological disorders in Panchakarma. Without diagnosis, clarification, clear-cut idea, you cannot start the treatment. Now accordingly you have to start the treatment. The next class we shall see neurological disorders in Ayurveda. Now modern wise we have seen so far, contemporary science wise. Yes, now in Ayurveda how you will identify which particular problem is there and how I have to proceed. That we will see in the next class. Thank you very much.